This is another Carillon conversation here at Carillon, Miami. I'm Dr. Alonso Martin, a functional medicine doctor with a background in primary care, specifically family medicine and psychiatry. And I'm very happy to introduce today's topic, which is micronutrient deficiency, discovering your greatest health potential. Before we dive into today's topic, I'd like to share with you that we've partnered with Feeding South Florida. It's a charity organization that is responsible for gathering, distributing, and making help available to individuals part of the hospitality industry that have been affected by COVID-19. We'd love if you would like to partner with us and help and donate to this charity. Here's the information and the website for everyone and anyone that's interested in being part of this incredible charity. We appreciate your support. And here are our social platforms if you'd like to follow us. So we'll dive right into today's topic. Part of micronutrient deficiency are our agenda topics. So we'll talk about the key to restoring health. A very, very popular and research topic today is people are wondering how to have optimal health in order to fend off infections, in order to live longer and healthier. So that'll be the first topic we dive into. Then we'll go on to micronutrients, absorption, and deficiencies. And we'll finish off with functional micronutrient testing. And again, today is more of an introduction to this topic. It's a very broad topic with lots of research behind it, and is just intended as an educational forum, as an educational presentation. And we'll dive right in. So lots of people ask, what is functional medicine? So functional medicine goes beyond just looking at a disease and associating the disease with a treatment or a medication. Practitioners of functional medicine look at one condition, for example, in this case, it's obesity. And we see that many different things can contribute to obesity, such as inflammation, hormone imbalances, your genetics and epigenetic markers, as well as diet and exercise, and possibly mood disorders. So all of these different contributors make a difference when it comes to one condition, such as obesity. We also look at certainly one imbalance, such as inflammation, and inflammation can have a huge effect on heart disease, on depression, on arthritis, cancer, and diabetes, just to name a few. So we really dissect and look at the root cause of what's happening and get down to the imbalances and really address what's going on, not just putting a Band-Aid with a medication or a treatment, but really identifying the root cause of someone's condition. And so what is the key to restoring health? So really the key is really establishing a relationship with a patient and really spending time with them, listening, looking at all of their imbalances and eliciting the patient's complete story during the intake. So I dedicate about 90 minutes to 120 minutes with each patient and go through an extensive background as far as their medical history, any environmental exposures they've ever had, any and all of their symptoms, really comprehensive intake. And that really is your fundamental starting point when it comes to really completing a functional medicine assessment. And then you want to start addressing and identifying the challenges that may be modifiable through lifestyle factors and environmental exposures. So everyone's lifestyle is different. And so when it comes to looking at a person's, whether they travel a bunch for work or for personal, or they have different exercise habits or dietary habits, all of this is part of someone's lifestyle. And it's important to really look at those individual components and personalize your recommendations for one particular person. And because one recommendation may be different for one person than for another person. And then you want to organize the patient's clinical imbalances by underlying causes of disease in a systematic biological framework. So that's just more of a clinical, structural clinical form to identify a patient's imbalances. And then you want to establish an effective and therapeutic relationship with a patient, so that there is a trusting patient-physician relationship, and that it's intended as a long-term relationship where there's communication that's open on both sides. And then finally, you want to create a good aging strategy for the patient that takes into account their lifestyle, their medical history, their current medications, and etc. and so forth. So the topic of the day is micronutrients, absorption and deficiencies. So what determines how well someone absorbs and how deficient they are in micronutrients? And when I say micronutrients, I'm referring to vitamins, minerals, antioxidants, and amino acids and other compounds. So those are the four main micronutrients that I look at when I determine whether or not someone is deficient or whether or not they are absorbing these micronutrients well. So every patient is different. So every patient has biochemical individuality. Everyone has different needs and micronutrient requirements. How much you actually need of a micronutrient, like let's say vitamin A, varies from person to person. What are the things that can contribute to those varying amounts and those varying requirements? Well, hormone balance can play a factor on how many micronutrients you need and what levels you need. Also, whether or not you've been exposed to environmental toxins, the status of your immune system, the status of your gut health, how much you're absorbing, how much inflammation is in your gut, and whether or not you have any kind of leaky gut picture in your system. And also levels of inflammation. We know that levels of inflammation can cause poor absorption of micronutrients. And of course, genetics all contribute to the individual micronutrients of a patient. So these are all things that I look at when I work with a patient and personalize their treatment plans. And then absorption of nutrients. What you are, what you absorb, and not necessarily what you eat. So the status of your gut, how well your gut is absorbing those micronutrients, is more important than actually what you're eating. So that's something I certainly look at with each patient. And malabsorption is very common. It's often aggravated by stress, which triggers the inflammatory response. And that can affect to the extent of how nutrients are assimilated, meaning how they are absorbed. And other factors that certainly contribute to absorption and deficiency are illness. Is the patient under physiologic stress because of a certain illness that they're currently suffering from or battling? Just as micronutrient deficiencies can set the stage for disease, health conditions and associated medications can also contribute to micronutrient depletions. And aging, we know as we get older, our needs for nutrients, minerals, vitamins, antioxidants certainly change, and we need more of them as we get older. And some of the more common nutrients that are poorly absorbed are vitamin D and B12 as we age. Lifestyle is another one that we've kind of already discussed, but the variety of habits that we have in our lives, such as physical activity, prescription and over-the-counter medications that we may be already using, smoking, alcohol use can certainly impact the individual micronutrient needs. So all of these things are things that I've discussed with as I'm working with patients. And the type of micronutrient test that I use is a functional micronutrient test. I look at 31 nutrients that consist of vitamins. So your typical vitamins like vitamin A, vitamin E, all the B vitamins, vitamin C, vitamin K, and then also your minerals, magnesium, potassium, sodium, calcium, all of those essential, selenium, all those essential minerals, and also amino acids, tryptophan, alanine, all of those amino acids that we talk about, and then antioxidants. Antioxidants are those compounds in our bodies that help us fight stressors like free radicals and oxidative stress in the body. And one question that comes up ever so often is whether I am checking levels of micronutrients inside the cell, actually inside the cell, what's being absorbed and used, or outside the cell, meaning what's floating around in your blood. So the test that I use checks for the actual micronutrients that are going into the cell. because we know that levels outside of the cell, the levels that circulate throughout the blood system, are transient. They change based on exercise, based on metabolic activities, based on illness. So we really want to look at what's the levels of micronutrients within the cell and the ones that are being used and metabolized for the cellular health. So how is this done? Well, we use the lab uses white blood cells. Those are grown in two different conditions, with micronutrients and without micronutrients in the growth medium. And then we compare the growth rates of both of those cells, and we determine whether or not there are functional deficiencies and functional needs needed. For example, vitamin A. And the functional test that I also use also looks at the stability of your cells, how well how well they can manage stress. So white blood cells are exposed to oxidative stress and free radicals, and their ability to metabolize carbohydrates is tested, and their ability to launch an actual immune response is also tested. So very, very sophisticated test, and it gives us a lot of information about what's actually happening within the cell, so within that white blood cell. And we then extrapolate that to use that to describe deficiencies throughout the entire body and throughout all cells. And once we have that information, I develop a targeted plan for supplementing patients' needs and requirements. And once this happens, patients typically improve their health, and they tend to get better. And so what does this look like? What does a targeted supplementation actually look like? So targeted supplementations is sort of like the treatment plan and the treatment objective once testing is done and once we have all the information about deficiencies. And we know that micronutrients work synergistically, meaning they work with each other. They form a delicate balance in the body. And this is a very important balance that needs to be always considered. And we know that more vitamins isn't always better. Actually, taking too much of one nutrient can induce a deficiency in another nutrient. So if you're taking too much, let's say, of vitamin A, that could cause a deficiency in vitamin E, and vice versa. So there is a delicate balance, and this is something that we have to always consider when making recommendations. And the key to targeted supplementation is to correct nutritional deficiencies that are specific for the individual based on their labs and based on their results. So once we have the results, we make things personalized, and we make sure that the patient is not taking too much of, let's say, vitamin B12 or vitamin K or vitamin C, and we really find that adequate balance for them in order to help them achieve their health goals. And again, balance is key, and this will help us achieve optimal health, help us achieve the adequate levels of vitamins, minerals, and antioxidants in the body. And so, this is, having said all that, the kind of the take-home message of this introduction is that cell function, meaning how well your cells are absorbing nutrients, how well they're transporting ions through all the different membrane transporters, and how well they're able to mount an immune response, is a direct indicator of how healthy they are. And micronutrient deficiency is a direct indicator of cellular dysfunction and oxidation. So if your cells are not receiving adequate nutrients, then they will start, they won't work properly, and they will become more susceptible and vulnerable to oxidative stressors and to free radicals. And those things can damage the cell membrane and eventually cause the cell to die and deteriorate, and can also affect your genetic function and your DNA. So if you'd like to learn more about this topic in particular, and if you're interested in getting this functional micronutrient deficiency test, you can reach out to us. The information is here below the take-home message, contact number, and the email. I invite everyone that's interested to reach out, and I'd love to work with you and find out more about your micronutrient status and really go through anything that you're taking already as far as vitamins and minerals, and come up with a good balance and a good supplemental targets and goal for all of those for anyone interested. And we are if you are interested, we are offering just a complimentary 15-minute session over the phone. So if you're interested in that complimentary session, reach out to us. Information is below, and we can go through all of that information with you. And I'm going to open up the floor for questions if anyone has questions at the moment. Oh, well, here's one. So question came in, is the test that you get with your doctor the same kind of test as a functional micronutrient test? That's a very good question. Unfortunately, the answer to that is no. The tests that are done in the typical clinical setting are to look at levels that are outside the cell, so the levels that are circulating through the blood. So again, the test that I use is the test that looks at the levels of micronutrients within the cell, the actual level that's being used and the level that helps the cell function. So very, very different kind of tests from the typical vitamin D test or the typical vitamin B12 test that you may get done in the typical clinical setting. And another question, are the supplements that I'm taking the right ones, and how do I know if I'm taking the right amount? Well, that's a great question. Most supplements or vitamin bottles give a recommended amount, and as you may recall earlier in the lecture, I said that nutritional requirements and the needs for nutrients vary person to person based on their age, their lifestyle, any existing illnesses, etc. Lifestyle. So, for example, if a patient is suffering from cancer or diabetes or renal disease or liver disease, their micronutrients need or requirement may be much higher than someone that is healthier with less chronic illness. So that is a very good question. We have a question from another guest asking, are these tests done at the Carillon? And yes, these tests are available at the Carillon. My office is in the Carillon in the wellness department. So if you are interested in having this test done, we can get it done at the Carillon. Absolutely. Would you recommend these tests for all ages? So I work with patients that are 18 and above, so mostly adults. But if you're a pediatric patient, or if you know a pediatric patient that may be interested in this kind of test, have them contact our office. We may be able to help them or guide them in the right direction. But I typically work with more adult patients. But yeah, these tests can be used with any age. We'll give the audience a little more time to see if anyone else has any more questions. But again, this is a great way to really look at whether or not you're doing the right thing by taking vitamins and by taking minerals and antioxidants. I take a lot of, not a lot, but I have my fair share of vitamins and minerals that I take on a daily basis. And I've had this test done myself, and the doctor that I worked with gave me the recommendations, personalized recommendations for my body and for my cells. And so I follow those, and really I've seen a lot of improvement since I had this test done last year. And of course, the recommendations that are given for me may be different than for someone else. So everything is personalized, and we customize every recommendation we give. And so I'd like to just thank everyone for attending, and it's been very nice to do these Carillon conversations and provide our watchers with more information, really topics that people care about. People care about the things they eat. People care about the supplements they take, because we all want to be healthier. We all want to live longer, be able to run and exercise and feel good. And so I thank the Carillon for this platform and for allowing me to get this information out there and really change people's lives and their health, which is why I do this, truly. And for anyone that's interested in donating to our wonderful charity, Feeding South Florida, the information is here on the slide. We'd love to partner with you. The hospitality industry was severely affected by COVID-19 and continues to be affected by COVID-19. And so if anyone would like to donate, I invite them to really partner with us. And I don't see any more questions here in the questions platform. So thank you again for joining us, and I look forward to sharing more information in the coming Carillon conversations.